In this video, we present a challenging case of pars plana vitrectomy for explantation of two intraocular lenses dislocated into the vitreous cavity. This video was shared by Dr. Bernardo Monte from Natal, Brazil. The patient presented to the emergency department with unilateral eye pain and had a history of multiple prior ocular surgeries performed at another service. On examination, there was significant intraocular inflammation and, surprisingly, two intraocular lenses dislocated into the vitreous cavity. In addition, there was an extra challenge, a third intraocular lens already scleral fixated using the Yamane technique. The goal of the repeat vitrectomy was to remove the dislocated lenses while preserving the stability of the scleral fixated IOL. A pars plana vitrectomy was performed, and perfluorocarbon liquid was used to float and elevate the first dislocated lens. Using two forceps, the lens was guided into the anterior chamber, passing through the inferior portion of the optic of the fixed IOL. Proper verticalization of the dislocated lens is essential to facilitate this maneuver. The lens was then explanted using the Pac-Man technique. The same maneuver was repeated for the second dislocated lens. The IOL was elevated with perfluorocarbon, brought into the anterior chamber, and then explanted after cutting the lens, always taking extreme care to maintain the stability of the scleral fixated IOL. The capsular bag was also removed to reduce the risk of anterior PVR and to minimize ciliary body traction. Finally, the corneal incision was sutured, the perfluorocarbon was removed, and the sclerotomies were closed. In the end, it was possible to successfully remove both dislocated lenses while preserving the Yamane fixated intraocular lens. This video highlights the challenges imposed by intraoperative decisions made at the time of a surgical complication. The presence of a lens dislocated into the vitreous cavity is, in many cases, a reason to suspend the procedure and leave the patient aphakic, in order to preserve ocular structures and facilitate the subsequent necessary surgery.